Hello, my name is Laura Cruz. I am the Director of Benefits Access at Senior Resources Agency on Aging, located in Eastern Connecticut. Connecticut Area Agencies on Aging, hereby known as AAAs, are private nonprofit service organizations that provide planning, program development, and grant funding for older adult services. The AAAs receive federal Older Americans Act funds and state funds through the Connecticut State Bureau on Aging. We allocate funds for elderly service providers through a request for proposal process. AAAs provide direct services in community education, advocacy, case management, information and assistance, benefits counseling, and training. We also administer what is known as the Choices program, which provides older adults with health insurance counseling, which we'll talk about that in just a moment. There are 5 regional agencies on aging in Connecticut, so by reviewing the map, you can connect with your area agency on aging in your location. So getting to the Choices program, the State Health Insurance Assistance Program, known as SHIP, is a national program that offers one-on-one assistance, counseling, and education to Medicare beneficiaries, their families, and caregivers to help make informed decisions about their health care and benefits. SHIP services support people with limited incomes, Medicare beneficiaries under the age of 65 with disabilities, and individuals who are duly eligible for both Medicare and Medicaid. There are 54 SHIP grantees located all within the 50 United States, Puerto Rico, Guam, the District of Columbia, and the U.S. Virgin Islands. In Connecticut, the program is delivered by the Bureau of Aging, Connecticut Aging and Disability Services, which partners with the area agencies on aging to provide free, unbiased Medicare information and assistance with enrolling into a Medicare drug plan or financial assistance programs to help make Medicare more affordable. In Connecticut, our SHIP agency is known as Choices. So Choices counselors, we are not insurance agents or brokers, and we do not benefit financially from assisting you. Before we talk about Medicare assistance with making Medicare affordable and Medicare preventative services, I wanted to talk just a little bit to review your Medicare coverage options that you have. As a Medicare beneficiary, you have 2 ways to get your Medicare coverage. You can choose the original Medicare option. Original Medicare is Medicare managed through the federal government, known as the Centers for Medicare and Medicaid Services. Original Medicare enrollees can go to any healthcare provider or facility that accepts Medicare anywhere in the country. Original Medicare includes Part A, hospital insurance, Part B, medical insurance. Medicare Part A coverage for inpatient hospitalization, short-term skilled nursing facility coverage, some home health care coverage, and hospice care. Most beneficiaries do not have to pay a monthly premium for Medicare Part A. Medicare Part B provides coverage for medical services from your healthcare provider, as well as outpatient care, some home health care, durable medical equipment and supplies, and preventative services. All beneficiaries owe a monthly premium for Medicare Part B, no matter how you get your Medicare benefits, unless you qualify for a state program to help pay the premium. And that's what we're going to discuss a little bit later on in this presentation. Most individuals with original Medicare will also want to purchase a Medicare Part B plan to cover prescription medications, and they may wish to also purchase a Medicare supplemental plan known as a Medigap plan to help cover the cost sharing for services that Medicare does not cover in full, meaning Medicare Part A and Part B deductibles, copays, and coinsurances. The other way to get Medicare is to enroll in a Medicare Advantage plan. These plans offer all the same benefits that original Medicare does, plus usually some additional benefits. Medicare Advantage plans often cover extra benefits that are not covered by original Medicare, such as dental, vision, hearing, gym memberships, and over-the-counter drugs. Some beneficiaries might get these extra benefits with a Medicare Advantage plan. If you are considering this option, you should carefully review the rules and limits on these extra benefits to ensure the plan covers the benefits you are looking for. Choices counselors can help you with this. Most Medicare Advantage plans bundle your Medicare Parts A, B, and D for hospital, medical, and prescription benefits into one insurance plan, and they are managed by the private insurance company rather than original Medicare, which the federal government manages. If you join a Medicare Advantage plan, you will need to see in-network providers who participate with the plan. You may also have to pay an additional premium on top of your Medicare Part B premium. You cannot buy a Medigap plan to help cover the cost shares, such as the Medicare Advantage plans, deductibles, copays, and coinsurances. Medicare covers many preventative services, and this is healthcare to help prevent illness or detect an illness at its earliest stage where treatment is most likely to work the best. You'll pay, nothing for these most of these covered preventative services if you get the services from a doctor or another qualified healthcare provider who accepts assignment. However, for some preventative services, you might have to pay the deductible, copay, or coinsurances, or both. These costs may also apply if you get preventative services in the same visit as a non-preventative service. So talk to your healthcare provider about the services that are right for you. Another preventative service offered to all Medicare beneficiaries is your one-time Welcome to Medicare preventative visit. The Welcome to Medicare visit is not the same as a physical. Medicare does not cover physicals. It is a visit to keep you healthy and screens you for risk factors of illness. You are entitled to this Welcome to Medicare visit within the first 12 months after you enroll into Medicare Part B. Medicare preventative services also include an annual wellness visit. So the annual wellness visit are, again, not physicals. They are simply a service designed to keep you healthy and identify potential risk factors such as heart disease, risk of falling, and so on. So for more information about preventative services, you could turn to the Medicare and You 2025 handbook if you have it. If you do not have it, please connect with your local area agencies on aging, the AAAs, and we'll be happy to provide this handbook to you. As you're thumbing through the handbook and you're turning to Medicare Part B services, any service that you see this blue apple next to it indicates that it is a preventative measure. And I would highly suggest that you read up on all the preventative services that Medicare has to offer and see if something is right for you at that moment. You can also view the Medicare and You handbook online at www.medicare.gov. So moving into the presentation as to why you're probably listening to this, we're going to talk to you about programs that can help save certain beneficiaries money on their Medicare. And two such programs are called the Medicare Savings Programs and the Extra Help Program. The Medicare Savings Program can help you by paying your monthly Medicare Part B premium. In Connecticut, there are 3 levels of this program. All 3 levels of the Medicare Savings Program pay your monthly Medicare Part B premium, and all 3 levels enroll you into another program, which helps you with Medicare prescription drug costs. And that program is called Extra Help. The Medicare Savings Program can also help you enroll into Medicare outside of other enrollment periods if you missed your initial enrollment period or if you do not qualify for what's known as a special enrollment period. And it may also help pay for any late enrollment penalties that you might have incurred by not enrolling into Medicare when you first became eligible. So if you qualify for the highest level of the Medicare Savings Program, it will also help pay for additional cost shares you may have with original Medicare, including your Medicare Part A and Part B deductibles, copays, and coinsurance. This highest level of the Medicare Savings Program is called the QMB program, also known as the Qualified Medicare Beneficiary Program. Just like all the other levels of the Medicare Savings Program, QMB is going to pay your monthly Medicare Part B premium and Part A premium if you need it, and will also enroll you into the Extra Help Program, which is a federal program that is designed to lower your prescription drug costs. You will, if you enroll into the QMB program, you're normally going to receive a gray State of Connecticut card, and it's pictured here on the right. This is what it will look like. This card is sent to you from the Connecticut Department of Social Services. If you have no other benefits through DSS, you would receive this card. But if you're already enrolled in another program, which helps you purchase food at the local grocery stores known as SNAP, you will already have this card and they will not resend you a new card. You'll receive this card because in addition to paying your premiums, this program also acts like a Medigap plan or a Medicare supplemental plan. And it assists you by paying, as previously stated, your Medicare Part A and Part B deductibles, copays, and coinsurances. In order to access this benefit, you are going to need to show each and every one of your healthcare providers this Gray Connect card when you go to the doctor for services, or if you are admitted into the hospital, you'll need to provide the hospital this information. The QMB program will pay your coinsurances and copays and deductibles for anything covered by the original Medicare program. Now, even if you're enrolled in a Medicare Advantage plan, this is the one time that will say that this will act as your secondary coverage, because this card is going to protect you from all your covered hospital and doctor services through your Medicare Advantage plan. QMB is not going to cover the cost shares for any of those added benefits with your Medicare Advantage plan. So if you are going in for any sort of services applied to dental, vision, or hearing, you are liable for whatever copays the plan says is your responsibility. Unfortunately, this Gray Connect card is not going to provide you coverage for those extra benefits that you might receive. The current income limits for QMB are effective as of March 1st of 2025, and they run through February of 2026. As you can see on the screen, as a single person, you can have an income as high as $2,752. If you are married, your joint income would need to be at or below $3,719 in order to qualify for this program. The next two levels of the Medicare Savings Program, they are called the Specified Low-Income Medicare Beneficiary Program, or SLIMB is the acronym, or the other level is called the Additional Low-Income Medicare Beneficiary Program, known as ALMB. These levels of the Medicare Savings Program pay your monthly Medicare Part B premium and enroll you into the Extra Help program. However, with these two levels, you do not receive that Gray Connect card because these two levels do not cover your cost shares when it comes to Medicare Parts A and B. Beneficiaries who have this benefit may still wish to purchase a Medigap policy to help cover the original cost sharing if you're in original Medicare. If you are enrolled in a Medicare Advantage plan, you are liable for whatever the health plan says is your responsibility to pay. And that could be a health plan deductible, copays, and coinsurances for your healthcare needs. As you see on the screen, these are the effective limits for these two programs. Please review the single level if you are a single person. If you are married, please review the income limit for couples. And again, these limits came into effect as of March 1st, 2025, and they run through February of 2026. To apply for the Medicare Savings Program, you at least have to be eligible for Medicare Part A, even if you didn't enroll into it yet. The application, the paper application, is a simple three-page application that a choices counselor can help you complete. You can also connect with your area agency on aging for this application to be sent to you. The great thing is there's no supporting documentation required for the application, though the state may sometimes request additional verification if there are questions about your application. The application can be completed either paper or online. It would be submitted to the Connecticut Department of Social Services. Choices counselors can help you fill out the application even if you wish to do that online, but we do not have the ability to make the determination if you're going to be eligible or not. It generally takes up to 45 days for the Connecticut Department of Social Services, known as DSS, to process your application. If approved, it can take an additional 90 days before the state of Connecticut starts paying your monthly Medicare Part B premiums. So you are going to have to wait probably 3 additional deposits of your Social Security benefit to see the reflection of change, meaning where the state of Connecticut is beginning to pay your Part B premium. However, unlike other state programs, there are no liens or state recouping or repayment needed of benefits for any level of the Medicare savings program. So this means that the state is not going to seek recoupment from benefits it paid on your behalf if you were to pass away. Again, the Medicare savings program, the eligibility in Connecticut is based solely on income. Assets do not matter. So it does not matter what you might have in your checking or savings account. It's solely based on income. And the Connecticut Department of Social Services is going to need information from you about all sources of your income. So as you can see on the screen here, all your Social Security benefits count, whether it's retirement benefits or you might be collecting Social Security disability. You might be receiving SSI. Even if you're still working, I don't want you to automatically feel that you're excluded because your combined wages plus other sources of income might put you over those income gaps. Not all your wages count as income. The state of Connecticut has what's called a disregard, and then they only count half of your earned wages. So please don't automatically exclude yourself because you might still be working and collecting Social Security. If you have any questions about what is considered income, again, please reach out to the Choices program. But as you can see on the screen, there's other income that you are going to have to make known to the Connecticut Department of Social Services. And that includes things like pensions, disability benefits, workers and unemployment comp, interest or dividends, even though assets do not count. The interest or dividends that you receive from those assets do count as income. And if you do collect rental property income, or if you receive alimony and or child support, those types of incomes are considered you do need to let the state of Connecticut know about that. Now, if you are enrolled in any level of the Medicare Savings Program, you're going to be automatically enrolled into a whole nother federal program called the Extra Help. This is also known as LIS, the Low Income Subsidy. Extra Help provides assistance with costs for your prescription medication by lowering the costs associated with your Medicare Part D plan or your Medicare Advantage plan with drug coverage. Specifically, Extra Help helps pay towards your monthly drug plan premium, about up to $52.52 in 2025 for most plans. If your plan is over that amount, you are going to be liable for paying a partial premium. Even though some of the plans might be lower than that, you may still have a partial premium. So it's best to be screened through the Choices program so we can help identify what plans you might have a zero premium for and what plans you might still have that partial premium for. The Extra Help also helps lower your copays for covered prescriptions. And what that means is the drug that you're taking has to be on the formulary of the drug plan you are using. Generics would cost no more than $4.90. Name brand will cost no more than $12.50, as long as the drug that your healthcare providing is prescribing is on the plan's formulary. Extra Help also provides you with what's known as a special enrollment period to change plans if needed. There has been plan special help enrollment changes as of January 1st of 2025. So again, we do want you to reach out to Choices for assistance. If you do not have a drug plan in place and you apply to the Medicare Savings Program and get onto the Extra Help, you are going to be automatically enrolled into an immediate temporary drug plan called the Linet program. That is LINET, which is administered through the Humana plan. This program will act like a prescription drug plan temporarily, usually up for 2 months, until you become or enroll into, say, just a standalone Medicare drug plan, or if you choose to get your healthcare options through a Medicare Advantage plan. So again, please connect with the Choices program because we can really help shed light on all these complex questions that you might have. The Medicare program is complex. There's no other way to describe it. Connecticut's area agencies on aging have limited staff to provide outreach and education to the Medicare program to Medicare beneficiaries. The Choices program relies on volunteers who want to learn and pass this complex information along to others. If you want to learn more about becoming a volunteer Choices counselor, please connect with your local AAA and ask for the Choices Regional Coordinator. And with that, I'm going to show the slide with all the direct telephone numbers to the Area Agency on Aging that may serve your needs. You can call us in-state toll-free at 1-800-994-9422. However, if you are from Eastern Connecticut, which Senior Resources serves all of Middlesex, New London, and Wyndham counties, and we have 5 towns in Holland. You can connect with us directly by calling Senior Resources at 860-887-3561. You could also refer back to the map that we had at the beginning of the presentation to locate your specific agency on aging, and you will see their telephone number directly here. I hope you enjoyed this quick presentation about making Medicare affordable through the Medicare Savings Program. Again, we really would like to hear from you to discuss your needs one-on-one, and we do offer appointments either in person, by telephone, or through web-based, maybe perhaps through Zoom or Microsoft Teams. So you all take care today. Again, thank you very much for taking about this 20 minutes with me to discuss this program. Take care. Bye-bye now.